Hello everyone, just a quick video today, as I always say. Nothing to do with fish tanks for a change, or ponds. This is to do with our border collies. That's Oscar, he's doing fine. He's a 5-year-old male border collie, big fella. Now this is Benny. Poor Benny, 2-year-old, feeling very sorry for himself. Benny swallowed a squeaker from a squeaky toy. We try and buy safe toys, things that can't be destroyed or swallowed, but unfortunately he got hold of a little dog Teddy, and being an inquisitive dog, he ate through it, got the squeaker, and before I could get to him he swallowed it. Well, Benny has just had abdominal obstruction surgery to remove the offending squeaker from the toy, and the surgery went very well. It was a very worrying weekend. He'd lost a lot of weight over 2 days, he was very sick. Our vets acted very quickly, took him in, x-rayed him, found the foreign object and asked permission to operate, and obviously I gave it and they took it out, and we've had him home 2 days now. We've modified the house, that's the sofa with the dining room chairs on it, so he can't jump up on that chair, and there's the other one, he can't jump up on that chair. We've got the beds in the living room, and on an evening we've been sleeping on an airbed, which is over there in the dining room at the minute, but we've been bringing the airbed into the living room, sleeping downstairs, so he can't get up on any furniture upstairs, or obviously can't use the stairs at the minute because he's got a big incision healing on his stomach, and inside his intestines have been stitched up, so any sudden movement wouldn't be very good. But I'm going to do this video quickly. Any questions people want to ask who are going through this right now, I know it's very, very worrying when your dog has surgery. We've been here before with our previous beautiful border collie Molly when she had a major leg operation. You've just got to modify and adapt, make the dog comfortable, try and take away any dangers, and importantly, keep the dog from getting bored. Now they're both looking at me thinking, are you going to give us these little treats? What I do, you get these Kong toys, and people put the paste in them, and things like that. And one vet channel once recommended putting cream cheese or peanut butter in them. Now that's good, that'll keep the dog entertained for a little while. But what I do, I mean, Benny's on a special diet at the minute. It's a special dog food we were given by the vet called ID. And obviously it's some special digestive dog meat. So what I've done is I've put a portion, he has to be fed 6 times a day, but very, very small portions. I've put a portion into this Kong toy, and although Benny is very calm at the minute and sedated, it gives him something to do while he's having his meal. To get bored, instead of getting bored, sorry, it gives him something to do. He'll have his meal, but I've frozen that. I put it in, sorry, I should have added. I put a portion in there and I put it in the freezer for an hour or two. It's not rock hard, and he will work on that now for about 15-20 minutes rather than like wolfing down his food, which is good for 2 reasons. It's better for his stomach, and it's better for Benny because he's a little bit entertained. Don't worry about Oscar. You're thinking, where's his treat? Well, Oscar's a vegetarian, poor fella. He's allergic to all meats. So in Oscar's is his usual James well-beloved fish flavoured food, which again I've put some water on and frozen. He'll take 25 seconds to eat that because Oscar's like that. He'll just get in there, crunch it, and get all the food out straight away. But poor old Benny, yeah, he's doing great. He's going to work on that, and it's just a good tip to keep your dog from getting bored. Any major surgery, you sometimes you're going to find your dog's going to get a little bit depressed. It's going to get a little bit bored because it's not up doing the usual things, playing and walking and things like that. So it's just a thing, you know. Like I say, I put in the special dog food. I think if you're going to use cream cheese or peanut butter, be wary. They're very high in fat, and your dog may put on a little bit of weight. In Benny's case, that wouldn't be a problem because he's lost about ½ kilo with the illness. He's wearing a little dog coat at the minute just to keep him from licking his wounds. I've got the cone of shame over there. We've taken that off him because if anyone doesn't know what a cone of shame is, what we call it here in England and other places, that's a cone of shame. And they're great, but they're not, you know, obviously as comfortable as not wearing one. So he's got a little coat on. If I have to go to the kitchen and get anything, it stops him licking his wound. He won't be wearing that all day. So there you go, little tip. Kong toy or whatever other sort of robust toy you can put treats inside. Pop in his favourite little treat, freeze it for a little while just to make it last a bit longer. And there you go. If anybody's got any questions about the operation or wants any sort of advice, I'm not an expert on it, but as I say, I've been through this a couple of times. Just give us a little comment down below. Thanks very much for watching.